Welcome to the State Infection Reporting Tool Workshop. My name is Eric Friend, and I am the Executive Director of Data and Information Systems at OSDE. I will be serving today as the moderator, and we have others on the call that will be available to assist with questions as well. We're here to talk about the new COVID reporting tool that has been developed jointly between the Oklahoma State Departments of Health and Education. In today's workshop, we will be focusing on the entering of BinaxNOW testing data, how that process works. This reporting tool is currently taking the place of the manual reporting processes that districts have been using up to this point to get COVID data to the county and state health departments in a secure, more efficient, and automated way. This system was designed to reduce the effort on the county and state health departments to obtain data from districts so that they may focus on helping people instead of entering data, especially as daily pediatric cases continue to rise. To be clear, this is the way the school districts should be reporting COVID positive cases and close contact quarantines to the county and state health departments going forward. Reporting should start immediately through this system, and you should be reporting any and all close contact quarantine and COVID positive case data that has not already been reported to the health department. You may have questions throughout this presentation that we may not be able to answer directly today. We are currently working on an FAQ document jointly with Oklahoma State Department of Health, the Oklahoma City County Health Department, and Tulsa County Health Department to address all of those questions. This workshop has been designed to show you how to enter cases and close contact quarantines and testing data. Please submit all relevant questions through chat, as these questions will help us to develop the aforementioned FAQ document and also give us ideas on how to enhance the application in the future. As a reminder, we will be focusing on just the testing section of this tool today and just demonstrating how to enter that particular data. I now have the pleasure of introducing the developer of the application that's been working with the Oklahoma State Department of Health and the Oklahoma State Department of Education on this reporting tool, Dean Hupp. Dean?
Thank you, sir, and thank you everybody for your time to attend our training session this afternoon. As Eric mentioned, we're going to be going over the BinaxNOW testing entry of all your positive and negative tests that you're doing on site. If you are not doing on-site testing, then this session would not apply to you. Your sessions that if you're not doing the testing and you're just entering positive cases and close contact quarantines, that would be the sessions that we did yesterday. And there's actually help documents in the application under the help menu that will go over that, as well as we're going to be posting the video from yesterday's sessions as well. So just wanted to let you know that. To start off with, most of you probably know it, but I just wanted to go through the beginning here and just sign in. You're going to access it through the SSO, just like any other application at the State Department of Education. It's going to be the State Infection Reporting System. This has already been granted to all district superintendents. Your other staff would need to be assigned by the district superintendent. So for instance, commonly the nurses have to get in here and are assigned, perhaps principals and some other staff, but all the district superintendents were given the app, and then from there they assign other local district staff. So having said that, I'm going to go ahead and close this, and then I'm going to go run our test environment. And now let me share this screen. Okay, and so now I'm logging in. I'm logging in as a district user. I frequently use Duncan as my test district, so if they're on, thank you for the use of your district. And the first thing you're going to see is a system message. This actually shows the updates that were done between yesterday and today. There's still a couple updates that were pending that couldn't quite get resolved. There was a couple things I wasn't happy with, so I'm still debugging a few things there. But there will be another update tomorrow morning that addresses some other things that are still pending. When you first get into the system, as many of you already have, you're going to see your landing page. It's basically like a dashboard that shows you kind of the current state of your district. This is always filtered for whatever level you're logging in as. If you're logging in at the county level, you're seeing county numbers. If you're logging in at the district level, you're seeing district numbers. And of course, if you're logging in at the state level, then you're going to see state numbers. One of the cool things is the little graphing tool to help you kind of see things and see trends. If you click in here, you'll notice that it actually has a drop down and you can add additional fields to the graph. And then we can refresh that. So that's kind of a neat tool. You can change the dates. And get updated graphs as well. And we're actually, yesterday they mentioned some really good ideas. We're going to provide a way to export this graph so that you can export it as a bitmap and then actually post it on your website if you want for your district. Looking at the menu to the left, this is our dashboard landing page, which is the home screen. We access tests at the test menu, cases in the case menu. All the patients for your district would be in the patients menu. The administration, this is going to be important for people that are doing the on-site testing. And what you're going to do here is this is where you're going to be able to manage your CLIA number. So what you'll see is if we come over to the test screen, you'll notice it says that I do not have a CLIA number defined. If you have not entered a test yet, you've probably already seen this message. So the first thing you do before it's going to let you enter any data is you have to add that CLIA number, and we'll get back to that in a second. The help screen has definitions of all the terms in the system, and it also has two links for help documents. The first document is from the health department and is guidelines on entering the on-site BinaxNOW testing results. So that's really important for this session. And then the second document is a help guide that goes over how to enter the cases, which we will not be covering today. But I just wanted to point those out so that you could see them. And they basically just open up. They should open up immediately in your browser, but depending on how you're set up, it may just want to download it and then you'll open it up there. And those are PDF files, so you more than likely can view them without having to install anything. So having said that, I'm going to go ahead and get back to the tests. And you'll notice, again, we don't have a CLIA number, so we got to do that before it's going to let us go. So then you click that button, it basically just takes you here straight to the administration. If you want to save yourself some time, come to the administration and then just say manage your CLIA number. I'm just going to go add it. And with the CLIA number is the clinic description. That's actually what the health department calls it, is it's a description of the CLIA number, and it's actually generally considered to be like a clinic. For you, the clinic is where you're doing the testing. So wherever you're administering the testing is basically what you're going to put in for the CLIA, for the clinic description. All right, so now that that's entered, let's go back to the test, and you'll see now the screen looks different. Now we can go ahead and add tests. We can also modify the test data that's already in there. You can see I've been putting in test data over the last few months. But again, we'll hit add test. Pretty straightforward stuff. The most important thing is getting your student or staff member entered. So you always want to start with the find student or staff member. Over 99% of the students have already been added. They're already in your list, and you can just go pick them. That saves you a tremendous amount of entry. So for instance, you can just go type person 3 and then pick the grade that they're in, hit search, and then they'll pop up right here, and it's searching through and pulling back all that particular student out of the 700,000 students there. So you'll notice though that I had to pick student. So again, if you pick student or staff, that's just a toggle. So you'll want to tell it which one you want. And then you have to put the last name or the birth date and the grade. You can add other fields if you want, if that's returning too much, but you have to at least put in the last name or the birth date and the grade in order to filter it. And that's really just to keep this result list from being, 300 kids long. As an example, I went through and in Oklahoma City, just searched for Smith, and it literally returned hundreds and hundreds and hundreds of kids. So it's really to limit those search results into something that could actually be digested. Most of the kids are in, but a little less than 1% were not able to be pulled in because they were missing addresses, phone numbers, email addresses. So basically that data was just empty when it came from your student information system to ours. So I did not pull it in because it's actually more cumbersome to go in and have to edit that after the fact, because then you got to pull the person up and then go back in and edit them. And so it was actually more cumbersome. And so I did not add them in if they were missing the addresses, which again was less than 1%. But if you're looking for a student here and you're not finding them, it's probably because they're empty and they didn't have any data associated with their student testing number. On the staff side, all of the certified staff are entered in. Over 90% of the certified staff are entered in, maybe even close to 99%. The only people that weren't added were people, again, that were missing addresses, but because they were certified, we pretty much had addresses, phone numbers, and an email for nearly all of them. Where we didn't have addresses was on the support staff side. So we know who the support staff members are because of the SPR system, so we can get a list of them. We know who they are, but SPR doesn't collect an address or a phone number, or an email for that matter, for the support staff. And since they're not certified in most cases, then we also don't have anywhere else we can go to pull that information. And you can see we've tried to pull this all together for you so you're not running around having to look for it. But for the certified staff, I think out of some 38,000, there were only 4,000 that we actually had a address for. I decided not to pull those in because I thought it would be confusing to have some of them in there and most of them not in there. But after the sessions yesterday, I'm actually working on modifying the system to make that a little more straightforward. And I'm going to pull in all the staff, even with the missing data. And I'm going to change this screen around a little bit so that you can just update the missing data right on here. I was hoping to have that done today for you, but between answering the phone and then trying to make those changes, which were fairly significant, it just needs a little more time to make sure it's all working right, because in a lot of cases it's assuming that data is present because it always was before, and now that it's not, it's causing some problems. I have to go through and test everything. But anyway, more than likely by tomorrow, Thursday at the latest, all of your support staff will be in there as well. So to repeat all of that, 99% of your students are already in. Over 95 or 96% of your certified staff's already in there and can just be looked up. None of the support staff's in there, but we're going to see if we can make some changes and get those in for you, just so you don't have to enter from scratch. So anyway, after all that, you do the search. You'll notice that I have the person that I wanted to add a test for down here in the search results. You just hit select, and then it's going to come back, and you'll notice that it's pre-populating everything. We can actually go view the patient data, and you can see it's pulled back all the data for you. So you won't have to enter in the address. You won't have to enter in phone numbers. You won't have to enter in anything where we've pre-populated all this data for you. So it makes it real fast and real straightforward. You just come in, hit Find Student, again, enter the fields that we indicated, hit Search, select it, and then you're down to number 3 here. So the first thing is your district, which will already be pre-populated. Second thing is pick who you're entering the data for, which again, you're just doing a search and it's already going to come in pre-populated. Then the last thing is the CLIA number. It's already pre-populated because you've already entered it for yourself. Test date defaults to today. Thanks to Larita from Shawnee, who helped me realize that that was defaulting to a date that didn't make any sense. So I fixed that for her today. The test is defaulting. The specimen type defaults. Really, all you have to do is come in, pick the student, go straight over here, indicate if the test was positive or negative, and then indicate if it was a final, preliminary, or corrected result. which most of the time I would expect that it's just going to be positive final or negative final. But these are the values that the health department has for the test. I guess sometimes they can come back kind of indeterminate, as they say. So once that's entered, you hit save. Oh, I got to enter the site real quick. You hit save, and then it adds it. And that's all there is to it. From there, if you had made a mistake and needed to fix something, you can just go pull it up and edit it. Also, up here at the top, there's a filter. So let's say we needed to pull up a certain patient that you had entered in. Now, again, I can see all the test data I've entered here, but you may get to the point where this is pages and pages long. You can just go up to the patient, hit the little filter, and we can go ahead and just type, for instance, my last name, Hupp, and then filter the data just for that person. And then from there, of course, you would edit it, make any changes that you want. If you pick the wrong person, you could actually go pick a brand new person. So we could come back over here, search for students, and then pick the person, and then completely change it. And if we update it now, you'll notice that it disappeared, of course, because our filter was set for me and I changed it, so it went away. We'll go ahead and clear that back out and put it back the way it was. And now you'll see that actually my name is no longer in the list because we updated it and changed it. And of course, if you enter one in incorrectly, you can just come in and delete it. It's showing you what you're going to delete, and then you can confirm it. Or if you just want to view the detailed information and even view the patient information, you can come in and see all that. So really straightforward. I think that at one point I had it down to 5 clicks. 5 clicks to enter a test. So you can literally get one entered in 15 to 20 seconds as long as your student or staff member is already present. We automatically send all this data to the health department every night, and then it gets loaded into their system. And then, of course, whatever normal processes happen at that point would happen just like they always have. So it's really convenient. You just enter it in here. From there, we'll communicate it up to them to import it into their systems. And really, you don't need to do anything else. Your work is done. So having said that, I guess we'll look and see if there's any questions that have come in, and I'll turn it back over to Eric.